Now, cancer is one of those topics that can sometimes be a bit of a taboo. We don't want to talk about it. It's one of those things that everyone in this room is going to experience at some point, not necessarily experience cancer itself, but will know someone close to us, family, friend that's going to have cancer. So just a quick question, does everybody know someone or has experienced someone who's had cancer? No, so the young ones probably not, but the older ones I'm presuming you have, yeah? So it's really important. If at any point you have a question, just stop me and I can answer it, that's no problem. So, just a quick disclaimer. So this is by the British Islamic Medical Association. We're a group of healthcare professionals, doctors, nurses, midwives, occupational therapists, pharmacists, and we work together to try and provide relevant material for both the kind of Muslim healthcare professionals, but also for the community like yourselves as well. A lot of this is also being provided by the Cancer Research UK, so everything on the slides has been validated. So if you have any questions, I can answer. If there's any problems, you can email this email and I can circulate that here. So there's quite a lot that we can talk about, but as Brother Nabil said, we'll try to keep it for about 25 to 30 minutes maximum. So we can talk about what cancer is, we can talk about how we can prevent cancer. So I'm going to give you some statistics about actually how you can reduce your own chances of having cancer. Obviously everything's covered and by the will of Allah. And then we'll talk about screening programs and actually what is available through the NHS at the moment in terms of screening for cancer. So, does anyone want to answer this question, what is cancer?
It's a disease.
Yeah, absolutely, so it's a disease. Does anyone know what type of disease it is or how it works? I'm going to look at you because I know you do sciences.
The cells grow up into...
Yeah, exactly. So, in our body, we all have cells. We have skin cells, we have cells in our heart, our liver, our lungs. And what happens is at some point, those cells, these are normal cells here, and those are abnormal cells. So it's the abnormal cells that start to grow, they invade our body, and then they cause disease. And you've heard of cancer spreading? So you can have a cancer in one part of the body and it can move to another part of the body. Okay. And the reason why cancer is so important, does anyone know why cancer is so important or why there's so much publicity around cancer at the moment? Anyone? Go for it.
People might be dying.
Absolutely, 100%. So, unfortunately, cancer is the leading cause of death in the UK, well, in England and Wales. So 28% of deaths is because of cancer. So if we can look at preventing cancer, or we can look at finding it early, then that's the best thing that we can do, especially as a Muslim population. The reason why this talk is so important is Muslims themselves are quite low at uptaking screening programs. You can think, why is that? Why is it that Muslims don't engage with the screening programs? And it's not just because it's our fault or, like everything else, Muslims don't get involved. It's because sometimes, like, I'll give you an example. The screening program letter came through to my house. My dad is proficient in English, he can read. He picks it up, he looks at it, and he's like, this is too confusing. He puts it down. I walked into his office, saw it in his office and said, you need to do it. But it took me to explain it to him. So I think for all the young people that are here, it's important that you speak to your parents and your grandparents and explain the screening program to them. So, let's talk about prevalent cancers. So, there's over 200 types of cancers, right? So a lot. Yeah, it can happen anywhere in the body. Now, do you know what the common types are? I'll talk you through them. So, we've got breast cancer. That's the commonest cancer in women. So, for our sisters, our mothers, our daughters, it's something very important that we need to talk about. Lung cancer. Lung cancer is very, very common, possibly the commonest cause after the kind of male-female cancers. Then we've got prostate cancer. Prostate cancer is in men, especially when you start having problems with passing urine, going to the toilet, usually in older men. And then you've got bowel cancer. Bowel cancer is of our intestines, and that's when you can have blood when you go to the toilet. You can suddenly start to lose weight. These are the symptoms. And this is a really interesting kind of stat. 1 in 2 people at some point is going to have cancer. So if you look at all the brothers in this room today, 50% of us at some point will end up with some sort of cancer. So it's really, really common, right? And that's why it's important. And then every year, 3,600 people are diagnosed. So, can cancer be prevented? Nods, yes? Yeah. Do you know how we can prevent cancer?
By catching it early.
Okay, so that's catching it early, but how can we prevent it full stop?
Diet.
Diet, yeah, 100%, that's a good one. Who said that?
Treatment.
Yeah, so again, treatments once we've got it. So is there anything else that we can do? Exercise, yeah, 100%. Okay, so we'll come to some of them. So basically, the statistics at the moment say that 40% of cancers can actually be prevented. So before they even start to become cancers, right? But for that, we have to do a lot of effort ourselves. So you know, like in the West, they say, my body is my temple. But as Muslims, we should also believe that our body is a gift from Allah, right? It's a gift that we use in this dunya and then we leave it behind. But we should treat it with respect in terms of what we eat, how we exercise, what we put into our body. We're responsible for that. Has this stopped working? There you go. So, preventable causes. So we mentioned a few already. So this is, first of all, we're going to talk about smoking. So this is something we haven't mentioned. Now, we all know people who smoke, right? Now, it's not just for any reason we tell people not to smoke. Not smoking is really, really important because smoking doesn't just cause lung cancer. It causes a range of different types of cancer, from the mouth to the bladder. Would you believe that smoking would cause bladder cancer? But it's one of the commonest causes, because you can see a big circle there. So if we can stop smoking, or we can help someone stop smoking, then that in itself is prevention of cancer. And then we talk about obesity. Now, as Muslims, we love our food, right? We love red meat, we love lamb, all these types of foods. These are the foods, unfortunately, that are linked to obesity and also in some way linked to cancer, and I'll come to that in our next slide. But as you can see, being overweight, mashallah, everyone in here is nice and slim, which is nice, but usually if you're overweight and you're not exercising and you're not eating the right food, then you're actually increasing your own chances. So these are the great foods to eat: fruits, vegetables, fish, chicken, perfectly fine. And then on the other side we have our fast food. You know, that's not great. Our processed and red meat, sugary drinks. These are all the things that we can look at improving, and inshallah we can look at reducing our own chances. And these are all, this is all being gathered from the World Health Organization. So this is cross-country, so this looks not just at the UK population, but everywhere. And this is all sciencey stuff, but I'm going to miss that out for the time being. So, screening test. Does anyone know what a screening test is? No? Okay, so let's talk about, yeah, go on, little one.
Is it like a blood test?
It can be, but not in this instance, okay? So what happens is, if you have a symptom, right? So you say you've got blood in your stool, and you go to the toilet and there's blood there. What's the first thing that you're going to do? What would most people do if they had blood in the stool? Would you go to your doctor?
Yeah.
Yeah? Okay, so you'll go to your doctor. That's usually later stages of cancer, when you start having blood and symptoms and losing weight. Screening is looking at actually detecting cancer before that point. Okay? So it's basically trying to detect it very, very early on, before you have any symptoms. So when you get the screening letter into your house, it doesn't mean that you're going to go if you've got symptoms. Even if you're absolutely fine, you've not got your symptoms, go, because if it's early stages, we're going to pick it up inshallah. So what we do is we take people, so say breast cancer, usually women over the age of 50, that's the population. We take all women over the age of 50 and we put them through this screening program. We take x-rays of their breasts and eventually we'll pick up some early stage cancers, and of those only a couple of people will actually have the cancer. So screening tools aren't 100%, but they're there as a kind of filter. Okay? Any questions so far? Any questions? Everyone happy? Cool. Okay. So it's all about detecting early. So one of the messages that Nabil sent out, we talked about this figure of 63%. So 63% of cancers can actually be detected at an early stage. And if we can detect them at an early stage, we're more likely to be able to treat them, and you can live a relatively normal lifestyle. And I think the worry for some people is, especially the ones that I spoke to, I had a young Muslim sister in the Rochdale Urgent Care Centre, right? And she got diagnosed with cervical cancer. And her concern was that she missed the smear program. And when I asked her, I said, you know, why did you miss it? She goes, look, I never thought it was going to be me. And I think that's the concern sometimes, right? We never think it's going to affect ourselves. But she was very, very late on at this point. And she was having she was having chemotherapy, but she was very unwell. And I remember her saying that she was going to leave her children behind. So it's very, very important that we think about how we can kind of uptake on these screening programs. But I'm not here to scare you, of course, because I think, you know, it's not about scaring people into having screening, but it's knowing that they're there and that we can take advantage of it. So, do you know which 3 screening programs I'm going to talk about today? Say that again, sorry?
I didn't see.
Oh, no. Anyone know which ones we'll talk about? Any ideas? Okay. So, we'll talk about bowel screening, then you've got breast screening, and you've got cervical screening. So, breast screening, cervical screening, obviously for the sisters. Breast cancer, men can get breast cancer, just to let you know. So, it's worth having a kind of feel of the area from time to time. But it's common in women, and we always screen women. And then you've got cervical screening as well, which is the younger kind of age group as well. So our sisters, wives, make sure that they're engaging within these programs. So bowel screening. So I'll talk about it quickly. There's a lot of slides here, but I'm going to try and go through this as quickly as possible. So when it comes to preventing bowel cancer, if we were to change our diet and we were to exercise more, how much could we reduce bowel cancer by? 50%. Anyone else? Should we get everyone to put their hands up if they think it's 50%? Not many? Okay, hands up if you think it's 20%. So everybody thinks it's 80%, is that right? 80% hands up? Yeah. Okay. So in actual fact, it's actually 50%. So it's not quite as high as 80%. It would be amazing if it was, but it's 50%. Okay. So this is how the statistics on bowel cancer. This is a key stat, right? So 57% of people that have a diagnosis can actually live normally for 10 years. So even if you were to have a diagnosis picked up, you can live for 10 years, 57% of people. So that's quite good, right? Like the treatment, mashallah, you kind of year on year is getting better as well. So these are the things that you need to do. Cut down on your red meat, eat high fiber. We talk about high fiber, oats, brown bread, that type of stuff, fruits, vegetables that are high in fiber, that's what you want to do. Alhamdulillah, we're not inflicted by alcohol, we'd like to think, so that's good. And then be more active, so get around. The Prophet ﷺ, he encouraged activity, yeah. He encouraged us to do things like swimming, archery, yeah, horse riding. Even if it's just going to the gym, it's important that we do activities. So I'm going to miss out the symptoms, does anyone want me to talk about symptoms, or should we leave symptoms for the time being? Yeah. If you want, it's basically about losing weight, bleeding, anything like that. If you have these symptoms, don't wait for your screening, go straight to your doctor. Okay, so if anyone has these symptoms, don't feel embarrassed, your doctor's not there to judge you. I know it's hard to get an appointment, right? Yeah, that's the hardest thing about getting to your doctors. But if you have these symptoms, let them know and they should be able to fit you in. So, bowel screening. There's a couple of different types of bowel screening, and I'll just briefly go over this. The first one is for men over 55. So if you're over 55, or you have a father who's over 55, brother, make sure that they're being offered what's called the bowel scope, which is a camera test. It goes into your back passage and it looks at all your inside bowels to make sure that there's no cancer there. Then there's 2 other types. These 2 types here are for people over the age of 60. If you're over the age of 60, you get a little packet sent to your house. Yeah, you take a small amount of your feces, your poo, you spread it, and you send it away. Has anyone done that? There's a few men here over the age of 60. Have you all done it? Have you received it? Man, fantastic, brilliant. So make sure you're always encouraging people to do that. And it's actually quite tricky, because as I told you about my dad, he looked at it and he put it away. So he wasn't going to do it until I saw it and made him do it. So if you see it and you see that your parents, make sure you ask them the question, have you received it and have you got it done, right? Because it's our fard as well to make sure that our parents are engaging in these opportunities. Right, so that's everything, right? So I was going to come to this slide here, benefits and harm. So I've talked mostly about the benefits, right? That the benefits are good, that we pick up cancers early. But there's also some harms of having screening. Does anyone know what those harms could be? What could be a bad thing about screening normal people without symptoms?
Find nothing.
Find nothing, yes, so it could be expensive, but that's not for us to worry about, because it's the NHS that are funding it. But the key thing here is that sometimes you could go and you could get a positive result, but it's called what's called a false positive or a false negative, right? So what that essentially means is you may have a positive result and you get called for more investigations, but at the end of it, it turns out to be negative, and that can increase our stress, our anxiety. But the main thing is that that's few and far between. So just because you have a positive kind of screen doesn't necessarily mean that you have the illness as well. Okay, so now we'll go to cervical cancer. Cervical cancer, important for our sisters. The reason being is cervical cancer, it can affect really young people. Most of the young people that we see with cancer, especially women, is often breast or cervical. Okay, so the cervical cancer, it's the 14th most common cancer, and about 870 deaths per year. And unfortunately, the problem with cervical cancer at the moment is that a lot of women have stopped doing the smear program. So have you heard of the smear program? Not heard of the smear program? Some of the other boys have. So smear program is really important. It takes place every 3 years for women. Okay, so from the age of 25, every 3 years they will have the smear program. It's important to have it done. There's a lot of this about the vaccine. Has anyone heard about the vaccine that they're giving in schools? Yeah, we have, a lot of parents have their apprehensions about the vaccine. I understand that, and I'm not here to defend all vaccines and all those debates around it. But in my personal opinion, I think it's important that we allow our children to have the vaccines as well, because if at some point they encounter the virus, at least they're protected from then potentially having cervical cancer. So we'll come to this. So I mentioned this already. Let's put hands up again. What age are women invited for cervical screening at? Is it 20, 21, 25? So hands up for 20. Hands up for 21. Hands up for 25. Yeah, fantastic. Everyone's listening, mashallah. So that's good. Okay. So again, it's about preventing cancer. Okay. So make sure the take-home message is that we make sure that whoever we live with, they're having these screening programs. Yeah. And the beauty is, 2,000 lives per year we're saving through this screening program. Okay, so breast screening. Now breast screening, again, this is more important for our older ladies. 50 plus is when the breast screening program starts. And it's very, very straightforward. But the scary thing is, it's the most common cancer. I'm sure all of us have heard about someone having breast cancer. I think in my family alone, there's been 3 women that have had breast cancer. And it's a bit of a taboo, right? It's a bit of a taboo to talk about it. But the good thing is that we should be open about it, have these discussions, and make sure we know that the screening programs are available. And look at this, 23% of breast cancer cases are indeed preventable. So, question here on breast screening. What percentage of women who are diagnosed in the earlier stages can survive for at least 5 years? Is it A, 99%, B, 88%, or C, 77%?
A.
A? Everyone A? Yeah, A. So if you find it that early on, it's actually A. But if we find it a little bit later, actually earlier, 10 years can be at 77%. So the way it's done, it's quite straightforward. It's just an X-ray that's done, 2 views. We look at them. If we find that there's something on the X-ray, we then refer for further tests. Okay. So this is something that I can talk you to. 100 normal women. Yeah. 96 have a normal result. 4 of them have an abnormal result. 3 of them don't have anything, and 1 of them has a diagnosis. So for every 100 people we screen, we're only going to get 1 diagnosis. Okay, so this is a summary. I'll just go through it quickly. So bowel screening is a camera test at 55. From 60 to yearly, it's an invitation through the post to send a bit of your sample away. For breast screening, 50 to 70 every 3 years. And then cervical screening is women aged from 25 to 64, 3 yearly until they're 50, and then 5 yearly after that. And the main reason for why people get cervical cancer is this virus here called human papillomavirus. That's everything. Any questions? Did I stick to the 30 minutes? Yeah. Cool.
Why does screening cancer have the word screening in it?
So it's screening because what that means is it's with